Welcome, everyone, and thank you for joining this afternoon. I'm Ferris Taylor, the Director of the Healthcare Executive Group, and will moderate today's webinar. We've outlined a flow for the discussion on the practical application of personalization to benefit members and patients, a very critical topic in healthcare. And we're excited to share our perspectives, but we also want to encourage your questions and your interacting with us. During the webinar, we will have a few graphics. We'll also be providing some links to resource material, and hopefully you'll be able to apply some of the discussion today within your own organizations. You can also link on this topic and other HCEG top 10 priorities at hceg.org, www.hceg.org. So before starting, let me mention a couple of housekeeping things. And there's been some chat with respect to this. All attendees will be on mute during the discussion, but feel free to click the Q&A button and submit questions during the discussion, or we'll have a Q&A session at the end. I'll monitor the Q&A and we'll share the questions with the panelists as they fit in, or take those in the Q&A time. We will also be sharing a couple of short polls, so watch for them. There is an option in the polls for other choices, and you can use the chat function so that everybody can see your comments on those polls. Finally, the webinar, as you heard, is being recorded, and we'll send it out to you, plus those that are not able to join live, as soon as we have that packaged up. Should be out within a few hours, at least by tomorrow. So let's jump into this topic of practical applications for, and I'm having trouble with my mouse. There we go. We have three excellent panelists. Angela Perri, who I've worked with for years, she's on our HCEG board, currently at UPMC Health Plan. Denise Holt with ICF Next, and Keith Roberts with Change Healthcare. So to get us started, could each of you take a couple or 3 minutes and tell us what you do in your organization, highlight your unique experiences with personalization, and what it really means to you, and then we'll come back and go into more details. That will get things started off today. So Angela, let's start with you, and then Denise and Keith.
Thanks, Ferris. Hello, everybody. My name is Angela Perri. I'm currently the Chief Medicare Officer for UPMC Health Plan. I also have responsibility for our internal software solution, clinical software solution here at UPMC that spans our health plan and our 41 hospitals and clinics overall. And before taking over leading Medicare, I had responsibility in the digital health space around telehealth and our digital experience overall. So I'm very happy to be here. Prior to that, I worked for multiple Fortune 100 companies, and have always sort of been in this personalization, member experience space in everything that we've done, from design of benefits to design of tools and applications.
And also a professor at UPenn.
Oh, and yes, and I'm also an adjunct professor at the University of Pittsburgh, the Graduate School of Public Health, and CATS Graduate Business School.
Not a busy lady. Denise?
Yes. Hi, everyone. It's great to be with you today. Denise Holt, and I'm the partner and head of strategy, experience, research, and insights at ICF Next. ICF Next is an integrated agency that does everything from business transformation efforts with our clients to integrated communications and loyalty one-to-one marketing and CRM strategies. I have a deep background in loyalty and one-to-one, and it's been very grounded over the years in having the end user and the customer at the core of everything we do. So understanding the power of human insights and really driving smart strategy and business growth has been at the center of what my team and colleagues do. I personally have over 20 years of experience in everything from consumer loyalty to brand and creative strategy, customer insights and leveraging that with human-centered design, and overarching business strategy and determining how each of these parts and pieces really connects to drive growth for our clients. And I'm excited to be here today. And I think, I actually have a few years background, not just in agency world, but in at Optum Health, where Keith and I had worked together. And we definitely have a variety of clients at ICF Next that cross multiple industries, including travel and hospitality, retail, restaurant, as well as healthcare and wellness industries. So I think the uniqueness then of my perspective in this conversation will be kind of tapping into learnings from other industries and how we can apply that in the healthcare space. Happy to be here.
Thank you, Denise. And interesting, all four of us have passed through Optum and United. Small world, but thank you, Denise. Keith?
Hi, good afternoon. Good morning to our Pacific Coast friends. I'm Keith Roberts, and I'm proud to lead the consulting practice of healthcare consumerism at Change Healthcare Consulting. For those of you who haven't worked with us, we're a healthcare-only, healthcare specialty consultancy, primarily working with regional payers in the realm of system modernization, population health, government programs, analytics, and insights. But in the consumerism context, which I lead, I guess the simplest way to define what I'm paid to do, what our team is paid to do is in collaboration with our clients, we're friction finders and we're friction fighters. A practical example of that is, and a topical one too, is we're spending a lot of time with our clients right now in the response to the CAHPS component of stars being quadruple rated and the implications that's having. We saw a lot of backslide in stars based upon consumer perception of primarily of access to care and finding care quickly. And some of the topics that we're going to discuss today around personalization, I've personally seen applied to reduce that friction, and so that's why personalization is such a powerful tool that we can use. So that's my context on the topic. And to get us a little bit warmed up, I'd like everyone, if you're old school like me, I've been in the business for 30 years. I actually started as an actuary. I still run analog pencil and paper, but if you've got some writing instrument in front of you, I'd like you to take 15 seconds and get in your mind, think of your last brick and mortar retail transaction. And now secure that in mind. And I'd like you to think about, take another 15 seconds just to, count the number of tasks required of you to find, access, and pay for that good that you needed or desired. And just write down that number of your most recent brick and mortar retail experience. And that'll come in handy as we talk a little bit further, but just wanted to open with that to get, we hope this is a discussion, is the intent. So thank you.
So Keith, in healthcare, you've made us all a little bit uncomfortable with your question. Hundreds of dollars spent in a matter of minutes, and but with different results. So let's dive a step deeper into this discussion. And in our prep calls, Angela, one of the things you brought up was, and Denise and Keith also referenced them, is really a different way of thinking about the term journey mapping. And I know I'm going to scroll to it. There's a lot of buzzwords that are out there. We'll talk about some of these, but and I have some of your slides if you'd like to use them, or you can just talk us through your experience there and how that's relevant to this personalization topic.
Sure. So I think when we talk about personalization, whether it's Medicare or if it's a commercial line of business or just in general, in the healthcare space from a managed care point of view. One of the things that we've shifted most of our cultures to focus on is the member. In the government space with CMS, they through the STARS program and their quality programs, they've definitely leaned much more in their weighting into a focus on member experience. But typically, as healthcare leaders, we tend to focus on the things that we need to get done. It's human to have our point of view be the point of view. And one of the challenges with personalization is really taking ourselves as an organization or as leaders in this healthcare space out of the things that we need to accomplish. We need to achieve certain HEDIS measures or STARS goals or these kinds of things, and instead take the point of view of our member. To Keith's earlier point about the number of touch points, when you start to think about how many different people interact with a patient or a member and what that experience must be like from their point of view, and you flip that so that you're starting to look at all of those different interactions across the lifetime of their experience with you as a plan or with their providers or with their hospital or whoever that is in that journey, you start to see how complicated and fragmented and frankly frustrating it is for those individuals. So the process of journey mapping is really less about us and more about them, and more about taking that patient, that member experience, and seeing it through their eyes. How many clicks do you take them through on your website? How many different people do they get transferred to on the phone when they're scheduling something? What's that initial experience for them when they first become your member? And then what does that mean? So this is part of our discussion today that we'll all talk about in various ways, but the idea is the actual member experience from the member point of view or the patient point of view versus from ours.
And Angela, along that line, you shared this sort of diagram of ups and downs. Do you want to expand on that or come back to it in a minute after Denise?
Sure. So, we've put some various slides together that start to explain what this is a little bit, but it's literally almost like an architectural map that outlines what exactly is happening from that patient or that member perspective. And then what are they feeling? How are they interacting? What's the layers of activity? Or you could break it out by department. You could break it out by the numbers of touch points. There's various ways that you can do this. There's a specific methodology around experience mapping that most folks in the digital space understand extremely well when they're developing apps and tools and things. But there's an analysis part of it that comes in really just understanding how to map out what this journey is that this individual is taking. And so Ferris has put up, one slide that walks through. This is just an example of what the map is and then the analysis and the pieces behind it. But it's a step-by-step process that identifies key moments that the member or the patient has with you when they first get their ID card. So they've selected, you as a plan. And then what does that experience look like all the way through to getting care? And what does that experience happen? And are there highs and lows in their journey and who is interacting with them? So it begins to give you a visual representation of what that looks like, so you can see from that member point of view where they see and where they have high anxiety or low anxiety, or where they're interacting with you, and what that means to them versus what that means to you internally. And the reason too that this is important is, just as a practical example, you might have people from member services calling, people from their practitioner's office calling. You might have marketing materials that's going to them. You might have a specialist that's contacting them, the pharmacy, all of these different activities that are coming at this person who is your member, that they may or may not know how to sort through. So you can see very quickly where you have opportunities for efficiency, for better alignment in your internal processes, and how you're communicating overall through this methodology known as journey mapping overall. So it gives you a very different point of view. We tend to lean towards process improvements as an industry. We like, I'm a Six Sigma black belt. I also like agile methodology, or, we love our methodologies. This is another one, but the thing about process improvements are we tend to lean into those segments of something we're trying to solve. And the great thing about journey mapping, and hopefully the others will jump in here, about this sort of method of thinking, is in today's world where we're pushed more, thanks to CMS and others, around the member experience and what that means. We're also trying to create efficiencies and find opportunities to make the experience better while saving money, while also challenging our teams to think differently. And you can very quickly get a different view into what that lens of opportunity looks like. So it can solve for you both on a member experience improvement aspect, at the same time that it gives you new ways of creating improvement or efficiency opportunities internally or across your health plan or your division or with your provider partners. So let me pause there for just a minute and see if
Denise definitely has a lot of experience there. Keith, we'll have you come back and make some comments on the poll, its results that are showing up here. But I was especially impressed, Denise, with your cross-industry perspective, which kind of connects the question that Keith has put on the table with what Angela is describing in healthcare. Take us into the customer emotional, you use the term loyalty, and I don't know as we really even use that term in healthcare, but your comments and perspectives on this.
Yeah, thanks, Ferris. And maybe you could even jump just for a visual to the slide that has the 6 drivers of emotional loyalty. And for the audience, I'll just jump back because the word loyalty tends to be used in more commercial facing industries. But really for us, loyalty means the outcome that you're trying to achieve with your end audience. So what is that relationship and how do you strengthen it? And how do you build an emotional tie with your end audience so that they feel that they are understood and they know, and that you know them, and that you're bringing, you have their best interests at heart. We did research at ICF Next a handful of years back now that was about uncovering the key drivers of emotional loyalty. Because emotionally loyal relationships are the hardest to break. They weather the storms, and it's this understanding that you both need each other. And what Ferris has popped up on screen here is the 6 key drivers that we uncovered that are to foster emotional loyalty. And that's trust, reliability, appreciation and investment, and empathy and shared values. Angela was talking about the key of being focused and really consumer driven in our perspectives. And so that was the intent of this research, is to really understand what is it from the consumer's perspective that needs to be in place in order to really drive a solid relationship with you. And these can be applied equally across industries. They also can be applied not just with your end user, but in building your relationships with your employees, who also help to deliver that end experience to your customers. And so we found it's been really applicable in each of these areas. And as you're strategizing and figuring out your plans going forward, if you kind of use this as a North Star, and we've even shortened it down to 3 of them: trust, appreciation, and empathy. If you ladder everything you do to demonstrating trust, showing appreciation, and demonstrating empathy, then that means you're headed in the right direction for really strengthening that relationship. And the reason to touch on that is, Angela, when you had your the customer journey map up and you were talking about kind of the synergies, and that we can't solve for customer challenges from a boardroom. And it's not, there's so many different things that affect an end customer experience. What we've been seeing is really this merging of user experience. Think about digital channels and how your company comes to life in a web experience, in a mobile app. What does that look like when you translate that into the in-person experience? That's user experience, customer experience. How do you take that a level up and understand all the ways that your customer sees your brand and interacts with your brand? And how do you make sure you're telling a consistent story across all of those different channels? I think the pandemic is clearly an eye-opener for everyone in how the ability to connect virtually in a healthcare atmosphere is important, and it helps with healthcare equity as well. So there's a huge focus on that. So how do we make sure that we're building those in-person and digital connections in a way that's really seamless and easy for the customer? And then the third component of this experience continuum is the employee experience. So how are you making sure to build trust, appreciate your employees, and have empathy for them so that you're able to empower them to deliver on a really great experience? And so interestingly, these components may have been started and fostered in industries like travel and hospitality and retail, but the implications of this is absolutely critical for the future of healthcare as well.
Yeah, I think it's a really great point, because again, we all try to learn from each other, and we're always trying to differentiate, who we are and what we do. But in this price conscious, price pressure and environment, we tend to again become very insular in our thinking about what we're trying to solve for and how we do that. And the learning here is by really changing that lens and focusing through, again, this is a journey mapping methodology, but just shifting that focus to what experience this member or patient is having with us, and how many touch points, to Keith's original question, how many clicks, how many things did you have to do to achieve that to get that good or service? You very quickly see areas of opportunity where you can have efficiencies. So it's both, it's being a good steward, of your financials and being able to drive something differently, and creating that positive experience by shifting your point of view. So it's one of those rare occasions where you really do get to create a win-win.
And Denise, you had shared, and we put this into just a quick slide as a summary so we can share it out, but ICF Next, and some papers are written. You've thrown out here also another buzzword, zero-party data. Would you like to comment about these 4 key bullet points?
Sure, would love to. Part of personalization is really understanding your customer at a one-to-one level, your patient, your member. Part of that can come from data, behavioral data, their history with you. But part of it is also about getting information straight from the source. And that's what we call zero-party data. So it means this is information that you've asked them some key specific questions, and the answers to those questions will be able to help you to personalize their experience in a meaningful way. And so that's when we say zero-party data, it means you're getting it straight from the source. You're not trying to infer it from historical data, but you're going right to the source. And a lot of times we're finding, especially in other industries, that people are absolutely willing to share personal information with you, and personal meaning things that motivate them, things that challenge them, things that are topics that are of most interest. Perhaps it's personal goals that they have for their health and well-being for the year, or concerns they have for their family. They're willing to share information if you're able to translate that into making their life easier and personalizing the experience that they have. And so up here, some team members of mine have done some great thought leadership and had published a paper that you'll have a link to afterwards on 4 strategies for connecting with your customers through zero-party data. And what the key to this is really, it's not about having a really lengthy profile form that they fill out or asking them a giant, 40 question survey all in one sitting, but it's really about making it quick and easy. You guys just participated in a poll during this webinar. That's a perfect example of quick hit questions that you can ask that bring meaningful insight to the organization in order to translate into ways in which they'll interact with you in a better, more personalized way in the future. So make it quick and easy. Give an instant benefit. Give them ways to either have access to new information or some sort of reward mechanism that could benefit them in the future, and keep it relevant and fun. Make sure that it's tied to topics that are meaningful to your organization and that will help to drive a stronger relationship with that individual. And then consider the occasion, meaning the time of year, the season, what topics could be of interest or top of mind to your consumer at the end of the day during that point in time. And how do you take this all together then, and then action on it in your communications planning and in the way that you develop your strategies? It will help you to more deeply understand your customer and be able to apply those insights.
So Keith, we've given you a lot of things to comment back on and to connect the dots here between that poll and your question. And I suspect you have additional buzzwords in terms of things we've talked about: foundational empathy, design thinking, behavioral segmentation. What's your experience with all of this?
Yeah, I mean, all of these topics, they feel very benevolent, right? They feel like, oh, this feels good to do this for people. I'm helping people. But we also need to look at this through the lens of a business case, right? And to kind of riff off of Angela's comments a little bit, one topical example of where member experience is front and center in boardrooms of all of our clients right now is the implications of CAHPS, or the Consumer Assessment of Health Plan and Systems, being quadruple rated. As Angela had mentioned, this is taking member opinion and perception of their interactions with your plan into account in your star rating. And we saw over 100 plans backslide from 4-star to below as part of the CAHPS weighting implication. So now CAHPS is 32% of the overall star rating. Comparatively, HEDIS is about 15%, but it's bigger than that. It's really a two-pronged problem, because when you think about CAHPS, 32%, well, those that respond are detractors in a CAHPS survey. They're also 15% less adherent. They're 25% less likely to have a primary for a chronic condition, 1/3 more likely to disenroll voluntarily from the plan, and they're twice as likely to respond negatively to the HOS, or the Health Outcomes Survey, right? So when you layer these interdependencies on top of the CAHPS, you're looking at 54% of the star rating is related to member experience. And that's why we're looking at this so carefully now, and embedding these modern methods to personalize and engage and activate our members, because the business case is real. You can't ignore it. This is no longer a priority. It's an imperative for our plans. And that's why we're leaning so hard into it, because that star rating, there's obviously financial implications for the 4+, but when a member is considering a plan to enroll in, 56% of their decision is based on that rating, and so it has enrollment implications too. So and that's just a business case for MA plans. That business case can be made for high deductible plans. It can be made for value-based care arrangements. It can be made for exchange arrangements too. So, you know, that's kind of the business case to all this, because if you take, you know, the journey map that Angela described that may have been founded in Six Sigma, you're trying to fit people into the experience that you desire for optimal efficiency. You take a journey map that Denise described that's founded in foundational empathy and in a real deep observational understanding of member needs, and you put those things next to each other, even if you're solving the same problem, they're going to look very different. And so that's why we're digging a little bit deeper on the topic.
And Keith, you're 100% correct that this human experience that Denise described is still under development in healthcare. You had shared the Harris poll research, which I think summarizes some of what you said. Anything more that you would like the participants today to capture from this graphic? And the slides will be shared, so as attendees you can digest this further. But any highlights here, Keith?
Yeah, thank you for that. I want to just share. This is fresh. You're amongst the first to hear some of these insights from this is a national signature research study conducted. It's fielded by the Harris poll and commissioned by Change Healthcare. This is the second one. You may have saw the first issue of results in 2020. But what this does is it measures the effort level at a consumer level of finding care in the leftmost column there, accessing care, and paying for care. And it measures this, I love it. It's called the Consumer Effort Index. How much effort are you putting into these things, these tasks? The first observation related to the question I opened with in my introduction is, you know, think about your last retail experience and how many tasks did you have to execute in order to find and access and receive the goods that you needed or wanted. This represents 29 tasks for an episode of care. So this is a national representative sample. So this covers, as you'll see on the right, MA plans, Medicaid, individual, high deductible, uninsured. Note that no matter how they're funding or financing their healthcare, the effort levels are pretty consistent. They're clustered for finding, accessing, and paying for care. The reason I asked about the number of tasks is, you know, the retail industry is very low task, and they do that to survive. They minimize that friction by being very intentional about the consumer journey, even a brick and mortar environment, to minimize that task to get you in the door and fill your market basket, right? So we will share these study findings with a link as a follow-up to attendees. But there's a lot of implications to dig into here, because what you find is the index is from 0, which is effortless. This is the easiest thing I've ever done in my life, all the way up to 200, which is profoundly difficult, almost impossible to achieve, with 100 being difficult. So 100's the kind of the grade line there. The finding care aspect of the journey is where we're doing best as an industry at 79, but it's still difficult. So I'd love to see in chat or something what people think the average difficulty is for brick and mortar retail.
And we had a chat comment from Adam referencing that, which I thought was very, very appropriate. So in fact,
it's less than half. It's less than half.
Less than half. And on the other side, you know, as you're showing here, accessing the care, paying for the care.
We go up to 130 effort index in accessing care, and you know that's related back to the CAP survey question of finding care or accessing care. Now, obviously, there's some systemic capacity problems there that are that are creating business challenges for our clients, but it escalates, it accumulates, it builds on this. This is an episode of care, and the tragic thing is that as part of this poll, 56% of consumers abandoned this journey because it was too difficult. They had a need for care. Because these 29 tasks of escalating degree of effort were so overwhelming, they just abandoned care. That scares me.
Mm-hmm. Yeah.
Does it bother you, Angela or Denise?
I was going to say that's something that, you know, when you're taking these kinds of data points, in my classes that I teach at the university, you know, I talk a lot because we're sort of taught to have a hypothesis and then basically go find facts to prove we're right. And this is an exercise really in turning that on its head and letting the data inform what we're doing, you know, and how we're doing it. So if you combine that together with doing things like a journey map, where you see and you can see mapped out very clearly over the course, to Keith's point, the 29 tasks or the 35 interactions or the 100 interactions over the course of a 90-day episode, you know, that happens. If you're dealing with an inpatient setting, or if you're dealing with a sick child, or if you're dealing, you know, with whatever it is that your population is that you're dealing with, the inefficiencies just scream at you on where and how you can do better and what that actually means. So the things that we're talking about today, you know, in this is CMS is pushing us down a path of member experience, retail, the pandemic overall. I mean, we've got shortages that we're dealing with from a workforce perspective. So access to care is critically important. How our staff are using their time is critically important. Which problem are we solving today and how are we solving it? This is something that gets at the heart of all of those questions, and really trying to be better informed on what we're doing to people. And in our attempt to be quality driven, in our attempt to be navigators or advocators, overall, we're solving a piece of the problem. And the thing that I love, again, about these journey maps or using data to really understand what we're asking of people from that member or patient experience is you get to see very, very quickly that it doesn't have to be that complicated, that there's enough for all of us to do. And there's so much to do to really improve what this looks like. We could be spending, you know, our time, you know, it's people, process, technology. We could spend, you know, much more efficient time overall creating these better experiences and creating more efficient processes and programs that are ultimately way more cost effective if we just change our point of view just a little bit. So it's we have it. Yeah, we have the means to do it. Now we just need to start to apply it a little bit differently in how we're using these kinds of tools.
And Denise, please go ahead. I keep hearing this word loyalty that you put out there, and what is, you know, what is it, and how do we get loyalty into healthcare?
Well, and I even wanted to just go back to Keith, those results of that survey. It's really staggering, and it is a great learning to see that industries like retail are much lower on the level of effort that is required in order to accomplish what you want to accomplish. And I think part of what you just hit on in that results slide is that they're impacting each other. Each of those different actions impacts each other. If you're very frustrated and it's a high level of effort in one component of that experience, you're bringing that frustration into the next part of that journey of care.
Yeah.
And they just exacerbate each other. And you end up with very exhausted, confused, frustrated members and patients.
Yeah, every one of those 29 points is an opportunity for somebody to decide if they're going to continue the journey or not.
Yes.
So first step is, can we reduce the number of tasks? Because that automatically reduces our fallout potential. So thanks, Denise.
Absolutely. And I think too, oftentimes, and I'll just bring the lens from maybe, let's just say it, travel and hospitality or retail, but let's say travel and hospitality in a journey. It's about figuring out where those points of interaction are and how do you get someone one step closer. That the end consumer does not see each of those actions you had up on screen as separate. That's all a part of their one healthcare journey. But I think too often as organizations, we go after this as siloed components to a journey. As Angela, you were talking about earlier. So how do we, with this view of customer centric, you start breaking those actions apart and understand the connecting points between all of those actions. And you start to say just what you said, Keith, how do you start breaking this down so that there isn't that high of a level of effort for someone to accomplish what they need to with you? And then how do we actually not just make it less hard, but make it more meaningful and personal to them? Allow them to have some sort of moment of feeling like I've been understood and they get me. They know what some information I provided to them yesterday in the start of this process. Mm-hmm. They've now taken that forward and brought it to life to make this next step in the process easier. And it should continue to build on itself to make it a wonderful experience, not a daunting experience.
I think that's really important too, because there's a lot of aha moments when you start to see what's really relevant and important to them. The things that we think of as necessary and essential in this journey, whether it's trying to adhere to compliance guidelines or trying to, achieve certain star scores, which, by the way, we are a 5-star plan for our HMO and PPO. So I'm very proud of that fact. But if you're trying to get a better perspective, on what that looks like, the things that really matter to them and where they have the highest points to drive your loyalty perspective in that experience overall are not always the same things that we are trying to drive from a plan perspective or even from a provider office perspective. So this, using the analytics, using these data points to really inform us differently, it creates some aha moments internally for us as well to say, oh, I didn't realize how important that was to this individual or this family or this caregiver in particular. And now, that's an area that we need to improve upon because we're not paying the right kind of attention to it, per se.
As leaders in the healthcare industry that are participating in this webinar, I think I'd love to kind of get a movement built around this concept, because if you look at the research in its entirety, coupled with what you learned here today, I'll put forward, and it might be controversial, but I don't care, that friction in the healthcare system is a social determinant of health. We always talk about transportation insecurity. We talk about food insecurity, very real SDOHs. When you look at friction and people abandoning the journey because of the friction, it's real. And when you carve it out, and again, it'll be in the white paper, when you carve it out, the process is more difficult in terms of effort level at the consumer perception level than transportation.
And time consuming. Yep. Over and over again. Yep. And then depending on your population. So I remember a statistic a number of years ago when I was working with children with intellectual and developmental disabilities, that in a week's time, 1 week, that family for that individual had something like 36 appointments
Oh,
on average. Now, of course, that then becomes a full-time job for the family overall. But imagine, whether it's moms and kids, or whether it's a senior having to get to their appointments, or what that means for a family. Because today we know, as part of the pandemic, that families sort of consolidated. You've got young families moved in with parents moved in with families, during that process. And so now family health is really something very different. And if you've got a senior, a child, and the parent or kid basically trying to work through everybody's health care needs overall, you compound that multiple times, because we also don't allow them to have a conversation about all of their members that are in one family. To them, it's, well, I've got to schedule my child to get their immunizations, and I've got to schedule my aging parent to get their flu shot. But you have to have 4 different conversations about those 2 people in order to coordinate anything. So that's just one example, overall of trying to lean into this space of better understanding what their experience is and what that means. And all of the things that Keith and Denise brought up about how do you do that? What's really important? How do you even find out what's important? Because it's usually not what you think it is.
right.
These are all tools to be data informed.
And I think
Other comments, Denise, Keith?
Yeah, I was going to say, I think too, part of this is about understanding how to be relevant in a person's daily life too. You don't want them to just think of you during a moment of bad health. How do you become seen as a partner in their holistic health throughout the course of their lifetime and their family's life? Angela, as you're talking about, on navigating the whole family health dynamic. And how do you do that and help to make that more seamless and easy? And that includes not compartmentalizing and breaking apart the experience into tiny little chunks, but looking at it more holistically. I'll give a travel example. Is if you think about like Delta Airlines, for example, it's the plane that you hop on to get from point A to point B, but they absolutely understand their customers, their needs, whether they're business travelers or leisure travelers or a combination of both. They understand that that's only one part of the travel journey. So they have strong partnerships with airports to make sure that your travel experience as you're getting to and going through and engaging at the airport is a really great experience before you hop on the airplane, in which they focus very heavily on great customer service. They make sure that the process of searching, Keith, you talked about that level of effort. When you're searching for a flight, we need to make it really seamless and easy and have the right tools in the palm of your hand to make that easy. And then getting you to your end destination. Even Delta Airlines and other airlines, though, they think about the pandemic and how instantly travel came to a halt. They had to make sure that they were relevant in people's daily lives and making that easier. And you've seen lots of partnerships come into play then. They know then that Lyft is an opportunity for them to get you to the airport and to pick you up once you've gotten to your destination and get you to where you need to go. So there's partnership with Lyft. They understand that a lot of times for us, especially busy business travelers, our days are sometimes fueled with caffeine. They have a Starbucks partnership. So they're thinking about it, not just about the airline hopping on the plane or how to purchase your ticket and get on the plane, but it's that holistic experience of all the parts and pieces of a travel experience. So I think we need to take some of those learnings from what that industry does and say, how do we connect the dots in a holistic health experience?
I think that's both of you, make really great points. And I agree with you, Keith, on the friction, as a social determinant for sure. And, when we think about the partnerships, Denise, I think in healthcare, we keep creating so many different partnerships, but then we don't make that experience. You might have a Starbucks at the airport, but somebody's there to say, well, you can't bring that coffee on the plane in healthcare. Like you have to use our coffee. Or, we had difficult, artificial barriers sometimes to that, even when we have good partnerships or even when we've created some different things. So, thinking again about that experience, Keith, I think to your point, that people sometimes just throw their hands up because they can't figure it out. And we as health plans, as managed care companies, I mean, we pride ourselves on trying to be advocates and navigators and, sorting through. I mean, God help you if you're, duly eligible for Medicare and Medicaid, you've got this eligibility and that, and all of these things, and you layer in, aging and the whole aging process from birth to death. Healthcare is present with you. It's like religion and politics, or just family dynamics. Your favorite uncle. It's always there, but we don't take into account those things always. We're very episodic in our thinking still, and our systems and our tools are set up for episodic thinking. But we're trying to drive to person-centeredness. CMS, in their infinite wisdom, is driving us down this experience path, value-based instead of volume, member experience, health equity. But if the process, to your point, for getting care, for finding it, for accessing it, paying for all of those things that are in your poll, if we create 27 different barriers for each one of those experience points in a single episode, imagine what we could do if we started to reduce most of those in those events over those time periods, instead of being event driven or triggers or episodically driven overall, because that experience is very painful in some of your most vulnerable times when you're sick or someone that you love is ill. So it's hopefully, for the folks that are on the call, some of these tools and things that we're talking about, the methodologies, the way to think about this a little bit differently. How do you become data informed, and which problem are we solving? Hopefully some of the things that we've brought up for you today will give you ideas on where to start, because we're all in the middle somewhere, solving for something up or downstream, but injecting these kinds of themes, injecting these kinds of methodologies, or starting to look at this, your data, your journey, your process a little differently, can really start to change the conversation and help us collectively move forward.
And
So,
Angela,
go ahead, please.
I was just going to say quickly, Angela, I think you hit on like the data and technology piece of that is so critical. So I think it really starts with the journey mapping with the member and patient at the core, so you understand their holistic experience, even if we think of it as siloed components of an experience, understanding that, and then highlighting those key critical touch points where a member's experience could either be helped or hindered along that journey. And then what you can do in those critical touch points is say, okay, how could we have made this touch point better? And if there's a personalization element, what is it that an employee, what kind of information or data would an employee have needed to know at this instant in order to make the experience for the patient much more personalized and easier? And that's where you start then overlaying what operationally and what from an infrastructure standpoint needs to be put in place in order to enable a better experience in those moments. But it helps to break it down then, so you can see you're not trying to solve for every single experience problem, because it's a mountain to climb, but it allows you to focus on what are those critical touch points that make or break an experience for the patient. And then what are those small steps you can take? And it can be as simple as data in the hands of an employee who can then translate that into a personalized experience in that moment. It helps you, the mapping helps you prioritize and figure out what's going to have the most impact. and then allows you to build a roadmap for how to get there, because we won't get there overnight.
So we have a couple of questions, and time is flying by, and we kind of anticipated this. One that I find interesting is, will all this personalization be rendered mute if and when Amazon takes over healthcare? Anybody brave?
Oh,
Keep
they're not taking over healthcare. It's, but there's a lot we can learn from their experience, certainly, and that sort of customization, but healthcare is hard. It's challenging because there's so many complexities and layers to it that are essential to drive equity a little bit differently, to help improve the process and to keep quality high and some of the other things that we're challenged with overall. But the infrastructure, there's plenty of money in healthcare. There's plenty of infrastructure in healthcare. We just need to get better at again, this experience and understanding that we can take a lot of the fragmentation out while still dealing with the complexity.
So there's another question that's come in, and that is one of the complexities of healthcare is the regulatory side. Is it does it limit our ability to do this personalization and customization? And the other question that I see is, and we can follow up with this afterwards, addressing the data privacy issues.
If I could weigh in there, I mean, I don't want to create any perception that anything we talked about today is easy. So that's why prioritization is so important. But on the regulatory front, as you're thinking about journey mapping, you start it with this foundational empathy or this deep understanding of member level needs. When you don't think about regulatory then, right then, when you're beginning to design the journey, all you're caring about is desirability. That's all. Don't get burdened by feasibility. That comes later. Regulatory is absolutely critical, but if you introduce regulatory at the front of a journey design, it's never going to get off the starting block, and you're never going to discover something that's transformational. So always start with desirability from the viewpoint of the member or the patient, then layer in the feasibility, including regulatory compliance, which is absolutely critical.
Yeah.
Just to build on that, Keith, I was on a conversation with Mickey Tripathi who heads up the Office of National Coordinator within Health and Human Services, and he was talking about information blocking, and he said he's constantly getting questions from healthcare stakeholders saying, "Well, if I do this, is this information blocking?" And he said the question itself is absurd. If you're not sharing the data, it's information blocking. So your point, think about how I can share that data and still protect the privacy and security, as opposed to saying, "Oh, I can't do it."
I've seen great ideas not come to life because of the specter of TCPA, Telephone Consumer Protection Act, right? But when you dig into it and you distinguish between marketing and sales, and you get very explicit and documented on your compliance with the regulation to achieve your objective, you can break through these things.
Yeah, I think it's to Keith's point, it's really important to begin with just what is happening, with our member or our patient, and what does that start to look like. And when you do that, we all do it through the lens of regulatory, and there's overreach, and then there's underreach, and then there's, but directionally, I think it's important that where CMS is trying to go in this focus on member experience overall, and pushing us down a value model and looking at health equity and looking at these things. If you take a step back and try to challenge yourselves or challenge ourselves with, what is it that means? It is about doing better. It's just take the fragmentation out, use what we know, improve the things that are more meaningful to to individuals and families, as you know, as Denise said before, and start with those things, and then see later from a regulatory perspective what things we need to do to comply with. But it's our responsibility as healthcare leaders, not just in managed care, but as consultants, as people who care, you know, about this health journey overall. You can't personalize anything for our membership and benefit design and patient experience and any of these things if you don't know what their experience is. And if it's always through our point of view, then we're missing whole swaths of opportunity to be better and to do better and to get people connected to the right care at the right time in a way that is meaningful and useful for them, not necessarily for us. And that is at the heart of all of how we bring all of these things together and try to do better. You know, just you know, let's just start there.
Angela, I think that's a great summary. I on the screen, and we will email out all of the additional resources on this topic, personalization. We also will share our contact information where Angela is part of the board of directors of HCEG. Send her questions for Angela to me, and I'll coordinate getting those back to you. You know, in quick summary, HCEG has been around for 35 years, trying to foster this thought leadership on critical challenges. And this is definitely the big one in front of us. Keith, thanks to you and Change Healthcare for helping connect us with Angela and Denise. Change Healthcare has been a sponsor of HCEG for 15, 18 years. So our partnership is greatly appreciated. I want to thank, on behalf of all of us on the session today, Angela, Denise, Keith, for the great conversation, and we wish you a great day. Thanks.
Thank you.
Thanks, everyone.